Breast cancer is a global health challenge. It knows no boundaries and affects women from all walks of life, regardless of their age, ethnicity, or socioeconomic status. This disease is not just a medical issue. It has profound social and emotional impacts on individuals, families, and communities. Millions of women around the world are diagnosed with it every year. Each diagnosis brings with it a wave of fear, uncertainty, and a myriad of questions. How will this affect my life? What will happen to my family? The emotional toll is immense, but so is the strength and resilience shown by those affected. It affects women of all ages. From young women in their 20s to older women in their 70s and beyond, breast cancer does not discriminate. The journey of each woman is unique, but the common thread is the courage they display in the face of adversity. Sadly, many women lose their lives to this disease, but there is hope. Advances in medical research and treatment options have significantly improved survival rates. Communities come together to support those affected, holding memorials and vigils to honor the lives lost and to inspire hope for the future. Early detection is our best weapon against breast cancer. Regular screenings and being aware of the symptoms can make a significant difference. Breast cancer doesn't discriminate. It can affect anyone, anywhere, at any time. That's why awareness and education are crucial. It affects women in all countries, rich and poor. Whether in bustling urban centers or quiet rural areas, the impact of breast cancer is felt worldwide. Cultural differences may influence how the disease is perceived and treated, but the need for support and understanding is universal. We must work together to fight this disease and protect women's health. Community support groups, health rallies, and educational seminars play a vital role in spreading awareness and providing much-needed support. Together, we can make a difference. By understanding breast cancer, we can take charge of our health. Early detection saves lives. Regular checkups, self-examinations, and staying informed about the latest research and treatment options are key steps in the fight against breast cancer. That's why it's crucial to be aware of the risks, symptoms, and screening methods. Knowledge is power. The more we know, the better equipped we are to take preventive measures and seek timely medical intervention. Let's learn how to protect ourselves and our loved ones from breast cancer. By coming together, sharing information, and supporting each other, we can create a future where breast cancer is no longer a threat to women's health and well-being. Breast cancer starts in the cells of the breast. It is one of the most common cancers affecting women worldwide, though men can also develop it. Understanding how it begins and progresses is crucial for early detection and treatment. Our breasts are made up of tiny glands that produce milk. These glands, known as lobules, are essential for breastfeeding and are connected to the nipple by a network of ducts. The structure of the breast is complex and includes various types of tissues. These glands are connected by tubes called ducts. The ducts play a vital role in transporting milk from the lobules to the nipple. This intricate system is supported by connective tissue and fat, which give the breast its shape and size. The spaces between the glands and ducts are filled with fatty tissue. This fatty tissue not only provides cushioning and support, but also contributes to the overall feel and appearance of the breast. Hormonal changes can affect this tissue, leading to variations in breast density. Cancer occurs when cells in the breast start to grow uncontrollably. These abnormal cells can invade nearby tissues and spread to other parts of the body. The exact cause of this uncontrolled growth is not fully understood, but it involves a combination of genetic and environmental factors. These cells can form a lump or mass called a tumor. Tumors can vary in size and may be detected through physical examination or imaging tests like mammograms. Early detection of these lumps is crucial for successful treatment. Tumors can be benign, meaning non-cancerous, or malignant, meaning cancerous. Benign tumors do not spread to other parts of the body and are usually not life-threatening. However, malignant tumors can invade surrounding tissues and metastasize to distant organs. Malignant tumors can spread to other parts of the body. This process, known as metastasis, makes cancer more difficult to treat and can significantly impact a person's prognosis. Common sites for breast cancer metastasis include the bones, liver, lungs, and brain. It's important to remember that not all breast lumps are cancerous. Many lumps are benign and may be caused by conditions like cysts or fibroadenomas. Regular self-examinations and screenings can help differentiate between benign and malignant lumps. However, any unusual changes in your breasts should be checked by a doctor. Early consultation with a healthcare professional can lead to prompt diagnosis and treatment, improving the chances of a positive outcome. Awareness and education are key in the fight against breast cancer. Breast cancer often doesn't show any symptoms in its early stages. This can make it difficult to detect without regular screenings. Many women feel perfectly healthy and may not notice any changes in their bodies. This is why it's crucial to be proactive about your health. Regular screenings, such as mammograms, can help detect breast cancer early, even before any symptoms appear. These screenings are essential because they can catch cancer at a stage when it is most treatable. It's recommended that women over the age of 40 have a mammogram every year, but you should consult with your doctor about what's best for you. However, there are some signs you should be aware of. Being familiar with how your breasts normally look and feel can help you notice any changes. Self-exams can be a useful way to keep track of your breast health. These include a lump in the breast or armpit, which may feel hard and have irregular edges. Not all lumps are cancerous, but it's important to have them checked by a healthcare professional. A change in the size or shape of the breast can also be a warning sign. This might include swelling, shrinkage, or an unusual contour. Pay attention to any asymmetry that wasn't there before. Dimpling or puckering of the skin, often described as looking like an orange peel, can be another symptom. Additionally, nipple discharge, especially if it's bloody or occurs without squeezing, should be evaluated by a doctor. Redness or scaling of the nipple or breast skin can also be a sign of breast cancer. These changes might be mistaken for a skin condition, but it's important to get them checked out. If you notice any of these symptoms, don't panic. Many breast changes are benign and not cancerous. However, it's always better to be safe and get any unusual changes checked by a healthcare provider. Make an appointment to see your doctor as soon as possible. Early detection and diagnosis are key to successful treatment. Your doctor can perform a clinical breast exam and may recommend further tests, such as a mammogram or ultrasound. Early detection gives you the best chance of successful treatment. By being vigilant and proactive about your breast health, you can take control and ensure the best possible outcome for yourself. Mammography is an X-ray of the breast. It can detect breast cancer early, even before a lump can be felt. This is why regular mammograms are so important. For women at average risk, it's recommended to start having mammograms every 2 years from the age of 50. However, if you have a family history of breast cancer or other risk factors, your doctor may recommend starting mammograms earlier or having them more frequently. Mammograms are safe and effective. The benefits of early detection far outweigh any potential risks. The treatment for breast cancer will depend on several factors, including the stage of the cancer, the type of cancer, and your overall health. Treatment options include surgery, chemotherapy, radiation therapy, hormone therapy, and targeted therapy. Your doctor will work with you to develop a personalized treatment plan. Remember, you are not alone in this journey. There are support groups, resources, and healthcare professionals dedicated to helping you through this challenging time. While mammograms are crucial, self-examination is also important. You should be familiar with how your breasts normally look and feel. Check your breasts for any changes once a month, a few days after your period. If you notice anything unusual, see your doctor right away. Regular checkups are essential for early detection. Even if you feel healthy, make sure to schedule your annual well-woman exam. Scientists are constantly working to improve breast cancer treatments and find a cure. Research has led to significant advances in early detection, diagnosis, and treatment, which have helped increase survival rates. By supporting breast cancer research, we are investing in hope for the future. These advancements give us hope for a future free from breast cancer. We can all play a role in raising awareness about breast cancer. Talk to your friends and family about the importance of early detection. Share information about breast cancer symptoms and screening guidelines. Encourage the women in your life to schedule their mammograms. Together, we can make a difference. By spreading awareness, we can empower women to take charge of their breast health. Don't wait for symptoms to appear. Take charge of your breast health today. Schedule your mammogram if you're due. Perform regular breast self-exams and report any changes to your doctor immediately. Remember, early detection is the key to beating breast cancer. Do you have any questions about breast cancer? Share them in the comments below. Let's start a conversation and support each other. And before you go, thank you so much for watching our video and please make sure to subscribe to our channel. If you want to give up alcohol, watch the video on your screen next.